You're listening to The Switch, a nonprofit HR podcast about all things talent management for social impact organizations. This episode is part of a special series with Lisa Brown Alexander, founder and CEO for Nonprofit HR. This special series focuses on all things organizational culture. Never miss an episode of The Switch. Visit us online at nonprofithr.com/The Switch. For this episode, Lisa Brown Alexander will interview Dr. Karen P. West, President and CEO of the American Dental Education Association. And now for some information about our conversation host. Driven to serve the often overlooked people management needs for the social impact sector, Lisa Brown Alexander set out to build a market where one didn't exist. She founded Nonprofit HR in 2000, the leading talent management firm in the country that works exclusively with the nonprofit sector. A serial entrepreneur, Lisa is also co-founder of Wellspring Manor and Spa, located in Prince George's County, Maryland. Lisa's goal is to ensure that every nonprofit HR engagement inspires social sector leaders to strengthen their most important asset, their people. Over the course of her career, Lisa has presented to hundreds of organizations, staff, and leadership teams, covering all things talent management for the social sector. Nonprofit HR has also been listed by Inc. 5000 as one of the nation's fastest growing companies. Dr. Karen P. West received her undergraduate degree from the University of Louisville in 1977 and is a 1982 graduate of the University of Louisville School of Dentistry, where she received a doctorate of dental medicine degree. She completed a general practice residency at the Medical College of Georgia in 1983 and was a 1992 graduate of the University of South Carolina School of Public Health, where she received an MPH degree in health administration. Dr. West also has a certificate in medical management from the University of Kentucky Gatton College of Business and Economics and was a 1999 fellow in the Executive Leadership of Academic Medicine program. Dr. West is a fellow in the International College of Dentists and the American College of Dentists. Before joining the academic ranks at the Medical College of Georgia in 1985, where she taught in the Community Dentistry Department and was the director of the Children and Youth Dental Clinic, Dr. West was in a private practice in Caneyville, Kentucky. From 1990 until 2007, she was a faculty member at the University of Kentucky College of Dentistry, serving in various capacities such as clinical team leader, associate dean of academic affairs, interim director of the public service division, and interim assistant dean of admissions and student affairs. Dr. West became dean at the University of Nevada, Las Vegas of dental medicine in 2007 and served as dean and tenured professor in the Department of Biomedical Sciences until June 30, 2019. She is currently Dean Emeritus. July 1st, 2019, Dr. West became the president and CEO of the American Dental Education Association, headquartered in Washington, D.C. Dr. West has been involved in EDIJ throughout her career. She has served as chair on both the EDIJ Council of Faculties and the Council of Dean Administrative Boards. Dr. West is a past chair of the Commission on Dental Accreditation and has served as a consultant for international accrediting bodies. In 2018, Dr. West received the EDIJ Distinguished Service Award. And now, here's Lisa and Dr. Karen P. West.
Thanks so much for joining us today, Dr. West. We're thrilled to have you join us as part of The Switch, a podcast series by Nonprofit HR. And as we get into this conversation, there's so much happening in the world today from a people and talent management perspective. And we've been using The Switch as an opportunity to get in the minds of CEOs of nonprofit and social impact leaders. And I'd like to get in your mind for a moment, if we could, talk about some of the talent management challenges and opportunities that you've faced and overcome over the last 3 years as an organization. And you can start wherever you'd like to, but help us understand what EDIJ has experienced from a talent management perspective since the pandemic.
Well, it has been challenging, I would say, and every CEO has experienced this. But my goal was to retain and recruit as many talented faculty or faculty staff, the whole gambit that we could. I felt like it was very important to retain our staff because they are the lifeblood of IDEA. They have the historical perspective. They can help train new people that came in. So my goal during the pandemic and afterwards has been to try to allow our staff to grow, to feel like they're part of an organization that cares. And I found it's not all about money. It's about the environment. It's about the culture that you have, and it's about listening. So my main focus has been to retain our wonderful staff, talented staff, as well as to recruit new staff to come in that will be a fit for us.
Mm-hmm. Let's talk about culture. You mentioned caring and listening, two very important kind of organizational cultural traits. Can you tell us more about the culture at IDEA and what you've done as the CEO to intentionally shape it?
Well, when I first came to IDEA, it had been led by someone very different from me. So I had to put my own stamp on it, so to speak. And I guess I'm a person who thrives in busyness and interaction and communication and just a back and forth type rapport with people. Since I've been here, I think that we have become much more open door policy. When we are in the office, we chat with each other. We're able to gain that camaraderie that sometimes is missing when you're remote, as during the pandemic. So I would describe our culture as open, inclusive, and collaborative, if I had to put 3 words on it.
You mentioned back in the office. It sounds like IDEA as an organization has moved back into an in-person environment. Is that the case, or have you embraced a hybrid work environment as so many other organizations have done?
We are a hybrid right now. All of our staff are in the office at least 1 day a week, with our chiefs coming in 2 to 3 days a week, the management system. However, as of July 1, we're going to a more remote environment.
Oh.
And we looked at the job descriptions of every employee and let the chiefs, their supervisors, decide if this could be remote local, which means they could come in as needed in 5 minutes, or remote, which might be in another state or town. We did that with all of our jobs. And as of July 1, our chiefs, our senior VPs, and our VPs will be in the office 3 days a week. The remainder will be in as needed or as they want to. We're not prohibiting people from coming in, and some people would prefer to work in the office. But I felt like it was important to listen to our employees, and I was hearing that they liked it, but at the same time, we needed to do more as an organization to train them on how to work remotely and how to supervise remotely, and also how to be able to maintain that team environment, that camaraderie, that community that allows the communication and collaboration to develop.
That's a really unusual model. The difference between the staff versus the leadership, that's a twist on a hybrid work environment. Can you say more about how you got there, the delineation between leadership having one kind of set of practices around how frequently they come in versus the rest of the staff? I think our audience would be really interested in that.
Well, I think the leadership found that we had to be in communication with each other daily. It was one of those things that during the pandemic, I felt some communication fell through the cracks.
Okay.
And I mean, if you think about it, for me anyway, it would take me 3 times as much time to set up a Zoom meeting and bring a group of people together, as opposed to needing 5 minutes within the office. And I talked with the chiefs and I asked them their opinion, and they all felt the same way, that it was important for us to continue that connection because it let the leadership, the executive team, be more, I think, on track with the organization's strategic plan, our strategic framework, our goals and mission. And then we all felt like it created less silos that way, that sometimes when you're in a remote environment, it can appear like a silo to a team. Maybe not the individual within that team, but the team itself in relation to other teams. And so that was one of the reasons that we decided this. And as you know, we never know where we're going to be one day from the other, if we're going to have another pandemic or something else will happen. But we felt like this was the right step for us here and now.
Sounds like a great win for your organization. What other talent management wins have you experienced, particularly over the last 24 months?
I think we've been able to recruit some outstanding leadership to our organization. A couple of those actually in dental education. As we deal with the profession, it's important to have a combination of both dentists or dental oral health professionals, as well as executive staffers who are experts in their own areas to interact with each other, because we need the expertise from the dental community as well as the expertise from our staff. And one without the other does not work. So I've been able to recruit two very high-level female chiefs to the organization from dental academics. I guess I stole them from there, and I know their deans probably weren't happy, but they have given us so much and such a broad perspective about what our membership needs too.
That's a great segue to my next question, which is around equity, diversity, inclusion, and justice. Sounds like you recognize and have benefited from the diversity of your leadership team, bringing different perspectives to the table. How has your organization and those in your network navigated through this equity, diversity, inclusion, and justice space, particularly over the last couple of years? Can you tell us about some of the work that you've done beyond diversifying your leadership team?
I think we would say dental education has progressed slowly, but it is moving forward. And I see it moving exponentially recently. So it's very exciting. We introduced our climate survey to dental education that you assisted us with, your organization. And this was the first one that had ever been done for dental education. So I think that gave an opportunity for schools, institutions, individuals to perhaps reflect and then assess and reassess what they had been doing, perhaps what they had been teaching, the environment in which we provide education. And we got some interesting data. And it was affirming for many people because they felt like that they were a leader in this area. And others, I think, learned some very good lessons. And now we're at a stage where we're trying to assist those with their individual reports to move forward, to go to the next level, provide them with toolkits, provide them with information on how they can diversify, how they can make their environment inclusive and welcoming so that the students feel like they belong. So that was the first big item, I think. But then we've also added some committees within the EDIJ professional organizational structure made up of members who are very invested in diversity, equity, inclusion, and justice, and sort of serve as advisory to us within the organization and within what we're doing in that area. I think that for me personally, I learned to listen. And that was something that perhaps I had not done as much in the past. I was a dean, the head of a dental school.
People listen to you, no doubt.
Yeah. Yes. I think it was very eye-opening, and it was a wonderful experience for me to listen, particularly to our staff during some of these troubled times. I felt like that has given me a new, light on the world. And I view things perhaps with a different lens than I used to before. But I think it's really an exciting time for dental education. I will tell you something that's really exciting. For the first time in our history, I think, we have 4 principal officers with EDIJ. It's myself, a past chair, and chair-elect for the board. 3 out of the 4 are women for the very first time ever.
Very good. Well, congratulations. You're on a journey clearly to become a more inclusive and diverse organization. And a lot of organizations are at the beginning of their journey.
Looking to integrate talent into your mission strategic plan? During annual strategic planning, organizations often overlook what talent is needed to meet their goals. Partner with Nonprofit HR for your organization's talent management needs. We offer HR outsourcing and project-based consulting, including strategy and advisory, retained search, total rewards, and equity, diversity, inclusion, and justice. We also offer customized trainings for your workforce. Join the many social impact organizations that have trusted Nonprofit HR to help them increase mission impact through their people. Visit nonprofithr.com.
In that you're kind of at the beginning, just kind of discovering where things are, have you begun to see any fatigue among your colleagues across the IDEA network for this work, or is it too early for fatigue? Or are folks still energized and excited by the possibilities, or are you beginning to see any weariness across the network?
No, I don't see that actually. At the current stage, I see excitement. I see people are really excited about possibilities. Our theme for our annual session in March was Believe I'm Possible. I think that really engaged people with everything IDEA is doing right now. And I don't see any fatigue. If I see fatigue, it's in my staff because they've been working really, really hard. Not fatigue for what we're doing, for our mission, but just fatigue because they're working.
In general. Yeah. It's been a rough couple of years for many folks. Do you have a prognosis for the future for IDEA as it relates to equity, diversity, and inclusion? And more broadly, what do you think other nonprofit sector leaders might look forward to 2, 3, 4 years from now in this space of equity and inclusion?
One of the key elements is, what is the environment out there? What environment do we live in? What environment do we work in? We probably 10 years ago reached a 50-50 student, women to men, student body ratio. But we are not there yet with faculty, with administrators, much less with our underrepresented minority population. We've still got a long way to go. And I think each organization is different, because they have to come to those critical numbers before they can really get a push forward and make change. I see us as coming out of this in 10 years with a very diverse dental workforce, a dental workforce who is there to provide care to their communities as well as globally. I think we have to invest in that. The more we become involved globally too, I think that will help us in that area. That will help us embrace the diversity more, because it's not just diversity of color, it's diversity of country, it's the wide ranging
global organization, right?
We are moving to collaborate with our sister organizations. That's one of our strategic areas. I think in the future, we will see a tremendous change in us. Other organizations will as well, some sooner than others, depending on when they start that internal change of the students, the faculty, the workforce. It's got to be incremental. We're not going to have an increase in workforce unless we have more students. And the same thing for faculty. So we have to start early. And we are starting much more early in recruiting now and exposing students to dentistry.
Would you mind sharing a little bit about what you're doing internal to IDEA with respect to your staff? So we've talked about your members and your member organizations, the faculty and staff of schools and colleges and programs. Talk to us, if you would, about any internal practices that you may have launched over the last few years with respect to the IDEA staff.
Well, first of all, we did not have a diversity officer when I came here. And so within 2 to 3 months, I had it appointed. It was my first appointment. I had appointed Sonia Smith to our chief diversity officer. She and I have worked tremendously well together, and we kind of feed off each other's energy, I think, about making change. She had 2 staff to begin with in her area. She has 6 now.
Wonderful.
So we have added 4 staff members to that area. And because of that, that has allowed us to be involved with new initiatives that we didn't have the workforce for. We didn't have the internal people for. They have been very busy in helping to write articles with members based on some of our climate survey findings. So we've broadened our communication about what we've been doing. and what we hope to do, which has been tremendous for us. We started a Men of Color initiative, and this was Sonia's area, where we brought together over 80 people representing different health profession organizations across the country. And that was a tremendous event. And we had former Surgeon General Satcher here with us, and he gave the address. But that was all my DEI team. They did all that, that they were able to make it happen because they have the passion and information, the intelligence, everything to move us forward in this area. And I'm so happy to say that we are still building.
Excellent. Do you have any advice, Dr. West, for CEOs that are struggling to move their DEI efforts forward? Any words of insight that you might have?
I would say to listen. Listen carefully. Don't just listen to your leadership team. Listen to your staff. I performed a listening exercise with my staff, not the executive team, when the George Floyd offense occurs. And I told them, I said, I have no answers, but I will listen. They opened up so much in that area that they saw that I was willing to listen, that help facilitate, I think, some of the culture change and the retention of staff. But I would say, listen. I would say, don't be afraid to ask questions of people. Even if you think it's uncomfortable, find someone you're comfortable with talking to, because that's important. Don't be ignorant about these things. If you have a question about, you don't know what to do, you don't know what word to say, find somebody you're not afraid to ask, because that's huge. And then finally, I would say just be open and don't be egotistical, because sometimes we think as CEOs, we have all the answers, and we do not. We can learn from a lot of different people. So that would be my advice.
Very pragmatic. Listen, do something with what you hear. Check your ego at the door. All great advice. All great advice. The last few years for CEOs has been particularly difficult, right? Both in the for-profit and the nonprofit sector. I'm a CEO myself and have been challenged in ways that I never thought I would have kind of pre-pandemic. We're noticing a rise in expressions of distress and stress among CEOs, particularly with respect to their talent challenges. As an executive leader of a large nonprofit organization, what people issues keep you up at night?
My staff's mental health, quite honestly, particularly during the pandemic. Not as much now, but I worried about their stress levels because I didn't know what each individual was dealing with. I was in my condo with 2 dogs and they kept me company, but I would have food delivered and, work on Zoom. And you don't know the situation of your employees many times. And you want to help them navigate this pandemic environment as much as you can, not only from a CEO standpoint, as you want to keep your workforce going and you want to keep people productive and on task, but the fact that they were dealing with a lot of other issues at the time with kids out of school. They were having to homeschool them. They were having to take care of elderly parents, perhaps, and then still work and be there for the rest of us in the organization. So their well-being and mental health probably kept me awake more than anything.
Has that changed now that we're emerging out of the pandemic? Any new things keeping you up at night that maybe are not pandemic centered?
I think now it would be, where are we going to be tomorrow? What's the environment going to be tomorrow? You read the news and it's all, doom and gloom. I guess now it's more of a general overall mental health of our country and where we exist in that. I worry about our staff being in a location that they can thrive while they work. And that's the reason for this remote work environment. And that's the reason that they can come into the office if they want to. But it's still along the same lines, but it's gotten broader, perhaps.
No, that makes sense. As we wrap up our conversation today, I wonder if you could leave us with a little insight about how you've personally grown as a CEO over the last 3 years. Where have you seen your leadership evolve? And if you look back at where you were 3 years ago and compare it to where you are now, what's been your greatest area of strength?
Being a dean of a dental school is very unlike being a CEO of an organization. So I had to learn everything. The fact that I was a dentist did help me in the organization, but I still had a lot to learn. And luckily, I had very good staff to help me. But I guess, as I said before, it's the listening skills. I was so focused before on getting the job done. I didn't take the time to thank people. I didn't take the time to think about what this meant for the organization as individual members. I was thinking broadly, the big picture. I have learned to be more thoughtful and reflective about decisions. I will say that because it impacts a lot more people than one school now, It's the whole country of an organization of dental education. Perhaps I've been a bit more cautious, but not much, but because I like to move forward. But I've been more reflective about decisions and receiving input from the stakeholders.
Excellent. I love that. It's so good to be able to reflect on your own personal growth and to evolve, right? As CEOs, it's important that we continue to do that. And it sounds like you've really flexed the listening, caring, and empathy muscles that are so critical to other CEOs as they run organizations through these difficult times. Dr. West, thank you so much for your time today. We look forward to hearing more about EDIJ's progress in all areas of talent management. But we certainly want to applaud you for the work that you have done and the inspiration you provided to our listeners today.
Thank you for having me. I appreciate it.
Well, that's a wrap on another episode of The Switch. Thank you to Lisa Brown Alexander, founder and CEO for Nonprofit HR, and Dr. Karen West, president and CEO for the American Dental Education Association. To learn more about EDIJ, visit them online at adea.org. To learn more about Nonprofit HR, visit us online at nonprofithr.com.